Watts, my friend. Man, I'm glad to see you, brother.
And you too, Steve.
Thanks for doing this, man.
Yeah.
I'm always honored that you come to these conferences, and we get together from time to time.
Yeah.
In between, and I really appreciate it.
Well, I'm really grateful that you invited me to the conference. Opened up my eyes, so I said I want to try to make this conference whenever I can. So I'm glad to be here.
Is this your second or third?
Second.
Second?
Yeah, last year was first.
Yeah. So, and you brought your wife this time. That's great.
Yes, I said last year was like water for my soul. I didn't know how much I needed it, so I said, Dee, please try to come. And so I'm sure she's going to have a great time starting tonight with worship.
Yeah, good. So, Bobby, you're the CEO of the National Healthcare for the Homeless Council.
Yes.
I say that right?
You said it exactly right.
Yeah. I think you guys are incredibly important partners for us, and we have a lot of overlap in terms of the people that we work with and that kind of thing. But and you're based in Nashville, Tennessee.
Yes.
But not a Nashville boy.
Absolutely not.
Yeah.
I grew up in Brooklyn, and we raised our kids for 30 years. Now they're grown in the Bronx for 30 years. So definitely a New York City person. But I'm glad to be in Nashville because the council is in Nashville, and I'm really grateful that I joined it 7 years ago. Yeah,
and a little bit about your background from in terms of working with the homeless. Like, how did you get into that?
Yeah, it truly was a God thing. I had deferred attending graduate school for public health, just felt really strongly led to do that. So I deferred for a year to work as a living counselor at a rescue mission on the Lower East Side of Manhattan. And I didn't know much about it, just felt I should do it. And ended up working there for 2 years. The second year, I started public health school, but and had responsibilities in the evenings and the weekends. And at that time, homelessness was just exploding in the public consciousness, and there was a new program starting, the National Healthcare for the Homeless program, and their New York City project had a clinic in my rescue mission. So part of my job was getting the guys ready to see the doctor when the clinic would come twice a week to make sure they didn't leave, if they had an open wound or a really bad cough. And I just saw how important that health work was for our ministry of serving the homeless men. So whenever I had an opportunity in graduate school, I would do a paper or a project on homelessness, and eventually ended up doing an internship with that program, and long story short, ended up working there for 20 years, the last 12 as executive director.
Yeah.
Up until I left to join the council.
Yeah. And how long have you been at the council now?
Just about 7 years.
Yeah. Well, yeah, you got some miles behind you.
Yes, I say, I have no more excuses now. Can't say I'm new anymore.
Well, you've been, how we met is you just have been such an important, played such an important role in the lives of a number of our organizations that in the CCHF network that do ministry with unhoused people, and one of those being our dear friend Janelle Getchus at Christ House, and you've been important to her. She's been telling me for years, you need to meet this guy, Bobby Watts.
Wow.
He's in Tennessee, like Memphis and Nashville are next door neighbors or something.
Yeah, right.
But I'm so glad we did, and you were just with them.
Yeah, I was with Janelle last Saturday. Yeah, wonderful to see her, spend time with her. I know she's been a pioneer in the healthcare for the homeless movement. I also know she was really important in the early life of CCHF. Just a towering saint, her and Alan, her husband.
Yeah, they are. I mean, in my time with CCHF, I think one of the things that I am most grateful for is the opportunity to become friends with Janelle and Alan, and just to occasionally be there. And I tell people, if you're new to CCHF, there's this guy named John Perkins, and John Perkins laid out for us kind of a challenge, a prophetic challenge, and a prophetic sort of pathway for engaging communities, what he would call strategic communities of need, or what we would call neglected communities and neglected populations. Janelle was the example. You know, like you look at Janelle, like what she and Alan have done and the way they have lived their lives have been the most challenging and most beautiful thing, I think. They've really shaped my life. I know they have yours as well.
Yeah, they certainly have.
Yeah. And so Janelle's health is not very good as we're doing this podcast, and I know you love her like I do.
Yeah.
And so then other organizations as well. I know that you've been real involved with the work at Lawndale, especially since. Were you involved with them much before COVID?
I knew of them, and I knew they were members, but didn't meet them until it was probably right before COVID at one of our conferences.
Yeah,
I met Dr. Tom Huggett, and I heard he was from Lawndale, and I latched on to him, and because I had been hearing of Lawndale for years.
Yeah.
But that was my first connection with him, and then got to meet them and their outstanding CEO and some other members of their team. And
then you've worked, I think, for years with LA Christian Health Center and on Skid Row and in Los Angeles, and more recently Hope Christian Fellowship or Hope Christian Health in Las Vegas.
Yes. Yeah, which I met through you. And they were also were attending our conference. So we have a number of members in common. Even though we are a secular organization, we focus on organizations that are serving people experiencing homelessness with healthcare.
Right.
And so we have a number of people of faith in our organization, as well
including,
as people of no faith.
Including you.
Yes, including me, thank God. I am so grateful for that. And a number of faith-based organizations join, are part of our network.
Yeah.
But I got reacquainted with CCHF, which I knew of like 20 years plus. Then kind of lost contact when I went to visit one of our members, Christ Community Health Services in Memphis.
Oh, wow.
And then I was just looking.
Where we're housed.
Well, that's what I found out. So I was visiting them for the first time, and I looked up, who the CEO and the staff, and I saw that Chantel Leatherwood, the CEO, was on the board of CCHF. And I said, oh, CCHF. So I said, let me go to CCHF. And I saw I had the same address. So when I went to visit her, she arranged for me to come up and see you. And though I was dropping in unexpected, as you are always, if you have the time, you make it very hospitable, and instantly just took me into the fold, for which I'm really grateful to you, Steve.
Yeah. The problem of unhoused, the plight of unhoused people is a continually growing problem. It's not gotten less.
Right.
Like COVID made things a lot worse in so many ways, and it's just continued to get worse since.
Yeah.
Anytime there's an economic downturn, we're seeing more and more unhoused, housing instability and things like that. One of the things, it's very difficult for our organizations as they're growing to ignore it.
Right.
Like we're involved, and we need to be really more connected, I think, with what you're doing.
Yeah, I think you're absolutely right, and thank you for inviting me to put together some panels, some more sessions, because I know there are many of your members that are serving people experiencing homelessness, whether they have particular funding for that or not. And what the council does, we have a lot of resources on our website for free for healthcare organizations and others that are serving people experiencing homelessness. So I really want CCHF members to take advantage of that, and just want them to be able to serve our neighbors without homes with excellence. And it's a special population with special needs, so that needs to be taken into account when delivering health services to this population.
Yeah, one of the things that I've been sort of fascinated by, I've always been fascinated with Christ House, because it's, what has it been, 40-something years now, 41 years or whatever, that it's been a respite care for homeless men, I guess. Maybe more than that. I know, it started back in the 80s and during the HIV pandemic and Washington, D.C. was a central place for that. And they started Christ House as a place where I always tell Janelle's story, and Janelle always says very politely, she says, "You tell it so much more interestingly than I do." I don't remember it exactly that way, and I tell people all the time, look, I'm not going to verify the accuracy,
Right.
but it should be entertaining anyway.
Right.
But like they started when she saw people that she knew showing up frozen to death on bus shelters and things like that in the winter, and just saying we cannot not do something about this. And they started Christ House it looks like a hospital, it smells like a hospital, but I think it's categorized as a boarding house.
Yeah.
Or boarding thing or something like that, so they kind of get around the JACO stuff and all that, but it's really good care.
Yeah.
And they're taking care of, for a long time, have been taking care of homeless men that are too sick to be on the street, but not sick enough that the hospitals will admit them, which is a justice issue.
Yep.
That is exclusively driven by profits and economics and not by the value of human life, clearly.
Yeah.
And anyway, and then from that, they have another area of, where homeless men that are kind of pulling things together but don't have families to go back to, where some of them live. Their Kairos House, the upper floors of Christ House, where Alan and Janelle live, and where
they raise their children.
They raise their children, where several of their staff have lived as long as they have. Mary Jordan is here at this conference and has lived there for, I think, as long as Alan and Janelle have. And it's just been an amazing thing. And so I'm taking way too long to get to the point here, but I've been fascinated by this respite care issue, what's happening in Las Vegas. It's just phenomenal to me, with the Christian clinic there, that during COVID had an opportunity where the city of Las Vegas called them and said, "Would you be interested in opening a small clinic in a shelter area that we're going to form?" And they laughed when they got the call and said, "I wonder how many people they called who said no before they called us." And as they said it, that passage of scripture where it says all the promises of Christ are yes and amen, and they just said, "Okay, new policy." Like every patient we've ever seen probably had no until we said yes.
Wow.
We're going to be everyone's yes. We're just going to say yes. Yeah. And God's met them in that. But how do you see? Do you see, what's their funding challenges to that and things like? How are you guys seeing that happening around the country?
Well, the genius of the council is that we help facilitate peer learning. I mean, we can have our mission statement, which we love, and so forth, but what really happens is that we are a loving community and very sharing community, and the council is that vessel where people working on the same issues can learn from each other and shorten the learning process. Learning what worked, and also, I say, as equally important, learning what didn't work. Yeah. And our members are really open with sharing. We tried this and it didn't work. So, medical respite is way overdue. It's growing. We started in 2020 the National Institute for Medical Respite Care as a way to lift it up. And it's succeeded. Lifting up medical respite has exceeded far beyond what we had expected, what we could have dreamed. So we've been able to attract funding that we've been able to re-grant out to medical respite programs. So in addition to providing training and technical assistance, which is what our bread and butter is of what we do, how we serve our community, we're able also to give funding. We have been able to give funding to help put those into practice. So we've been part of helping medical respite grow throughout the country. Also, a number of states have said we want this to be part of our Medicaid program so that it can be sustained. And we've been able to give input in how to craft that, those regulations and that legislation. So we're just really, really grateful. But even when you talk about Christ House, and For years, I've heard Dr. Jim O'Connell in Boston and Dr. Janelle Getcha say they had the first medical respite program in the country. So finally, I got them together. Say, what happened? We both say you're the first. And what happened was, one of them started a few months the planning for it, and independently they were. The other was working on it. They found out that they were working on it, then pulled forces together and worked on it together.
Yeah.
So one started the planning and one opened the doors a few months earlier. So both of them in one way can claim to be the first. Yeah. And they both are part of the council, and that's just a way of been part of our DNA from our founder, John Logier, and the group that first started this 30 plus years ago, of just a community and working together. So yeah. Medical respite is a shining example, how these two programs were working on it independently, started working together, and now there are at least 150 medical respite programs around the country. 150
around the program.
At least.
That sounds like quickly. A lot when there hasn't been hardly any. Correct. But it's not nearly enough. Like this is an area, a really high needs area that we need to. Some of us need to really pray about leaning into in our communities. Yeah. And I mean, the fruit from it is amazing. Just talking to Steve Flores in Las Vegas, and some of the fruit that they're seeing from that has just been phenomenal. Yeah. Yeah. And I really appreciate you framing what happens to our community, people without homes, when they don't have a place to stay but can't stay in the hospital, as a matter of justice. You didn't use those words, but that really is how you described it. It really is a matter of social justice, and it is so appropriate for faith-based organizations to be taking the lead in that. Yeah. Really, that's what motivates me, though I work for a secular organization, that knowing that this is what God wants. He wants us to love our neighbors the way that we would want to be cared for and loved, and that's our responsibility and our privilege. And to see so many organizations grabbing hold of it is really a beautiful thing and an appropriate thing. Yeah. And as you said, more of us should be leaning into it. Yes. I'm grateful. Like this year, you've kind of brought a team with you to kind of help. And I think y'all are doing maybe three workshops with help from, you know, Dr. Huggett you mentioned, and others. You know, I appreciate you guys are like the go-to source for best practices in this, and I appreciate you sharing, you know, like cutting the learning curve short for us as well. I really want us as a community to be more engaged with the work that you guys are doing and to be better partners, I think. And I want to encourage our folks to, you know, check out your conference, to certainly go to your website and to look at different opportunities. If they have any questions, they should, you know, like I have always found you to be available, accessible, responsive, and, you know, so what would you like, how would you like for them to connect? Sure. You know, the best way is you can go to our website. Like I said, there's lots of materials there, also ways to get in touch with us. So that's www.nhchc.org, as in National Health Care for the Homeless Council.org, nhchc.org. Yeah. And from there you can look at our different staff, look at my email address, email me, and we will certainly get back to you. Yeah. Well, again, thank you so much for being here. Thanks for taking time to do this. I really hope this kind of builds some traction and a deeper connection between our two organizations, our two communities, because I think we have the same heart. And I know you and I share the same heart at every level, and I appreciate that. I appreciate our friendship too. Same here. Thank you for bringing me into the fold and lifting up homelessness among CCHF. Really appreciate it. It's so important. All right. Thanks so much. All right. God bless you, my brother. Bye.